I'm 14 years old. I am living positively with HIV. My mother is also living positively with HIV, and I am the only child in this house. My father died when I was still young.
Despite the unprecedented progress made in the fight against HIV and AIDS, emerging evidence suggests that adolescents are falling behind as a result of not receiving the attention and services they require. Adolescents living with HIV face unique challenges like disclosure, stigma, antiretroviral therapy, and prevention of HIV transmission. Rachel, not her real name, is among hundreds of adolescents in Homa County who contracted HIV from their mother in the womb at the point of delivery, shortly after birth, or while being breastfed.
I'm HIV positive since 2004. I was put on ARVs. I never attended PMTCT clinic. By then, my child was 1 year, 6 months. My child was tested positive. She was put on drug. We used to go there every month to collect our drugs, but it was very, very painful.
When I was 7 years old, I asked my mother why I was taking those medicines. Then he told me that I am living HIV positive and that I got it through mother-to-child transmission.
It took me a lot of time. In fact, I was sometimes crying.
And then she disclosed to me all the things. Then she told me not to worry, that I'll be all right. Then I asked her if there will be a time that I will not take those medicines, that I will just be all right. She said no, that medicine you will take until death do your part.
Mpaka she cried. Why me? Everybody's not taking drug in this home. Why me, ma'am? I told her she was not my fault, and then she understood me.
I knew that people who has HIV, they will die, and they will die thin, and I knew that it is a curse from God.
I always telling her that HIV is not pressure, it is not cancer. HIV is like any other diseases, like malaria, which is being treated.
Not so far away from Rachel's home, we meet an exuberant teenager full of life.
Ebola ndio mbaya, ndio. Ebola inaua watu na HIV haiui watu.
Kate, a funny name, wears a constant smile, and her wit inspires all who meet her.
Hata ukiona hivi huwezi jua mimi niko na HIV. Mwili iko sawa.
She has been living with HIV for 14 years now and has known about her status for 6 years.
Tunaishi na nyanya, na tuko watoto 4. Mamangu alikufa 2004 na baba akakufa 2013.
At the age of 9, Kate started falling ill, and with that, endless visits to the hospital began.
Koro nao mikutuo no awinjo no tuo tabia ome na biro koreka kutuo kabisa moko nyal ko kende gi min matino ben ngama be maduong koro biro koreka koro biro koreka tiririana sibtal kod motamo wanga kon yawa adhi pima na nyathini kata ka utuo koro kadhi pime onwang ni en gi tuono.
Hali yangu nilijua kama nilienda hospitali. Nilikuwa nimeenda kama nimegonjeka, lakini nikapimwa. Sikustuka juu bado nilikuwa mdogo. Sikuwa najua kitu.
But with constant support, she was able to embrace her status.
Shosho aliniambianga nizaliwa nayo. Nikaendelea na kumeza madawa zangu. Nilikuwa nimeanza na dawa za TB, Nikamaliza hiyo nikamaliza, alafu nikaanza hii dawa.
Although a fast-rate medical system has kept her healthy and strong, she has suffered at the hands of an otherwise caring community.
Kienda kuchota maji kwa mto, watu wengine hata kuchota na mimi. Wataki nicheze na hao, kukaa na hao pamoja juu niko na mgonjwa nitawapea. Ndio tunakaa, naomba tu Mungu anisaidie niendelee na kazi yangu. Kwa mimi niko na hasira nyingine yoyote. Kwa nasema tu, wewe tu ni binadamu kama wewe. I'm 16 years. I live with HIV AIDS.
Rhoda, not her real name, shared with me about living with HIV and her positive journey through adolescence. But her extraordinary journey of survival has not come without its dark moments. Rhoda's parents died when she was a baby and her grandmother raised her.
Mamake alikufa kama yeye akona miezi 3. Alafu akakaa miaka inaenda kama 8 hivi. Babake akafariki. Nilisumbuka na ugonjwa wake haisi. Tumbo ilikuwa imefura. Sasa nikafikiria ni nini. Sasa nilianza na madawa mengi ya kienyeji ati ndio ipoteze hiyo ugonjwa wake wa tumbo, lakini sikuweza. Nyuma yake aunti yake akamchukua akampeleka hospitali.
When I was 8 years old, I used to get sick. The doctor tested me, then they got when I was positive. Then I was afraid if I had like that.
Lakini babake alifariki kama ninajua ako na hiyo ugonjwa. Na mama yake sikujua. Sasa nikasituka sana. Sika na huruma sana, nilisikia vibaya. Nikafikiria sasa nani? Huyo mtoto atameza hii dawa ambayo inamezwa kila siku mpaka siku gani? Huyo msichana wangu akaniambia, mama, poa tu. Hiyo dawa inasaidia. Sasa nikaanza kumbeba nikimpeleka hospitali. Mpaka akakuwa mkubwa. Mpaka akaanza kwenda sasa peke yake.
Eventually, Rhoda slowly began to understand her status and how she could take care of her health.
Kianza kumeza dawa, nikaona sasa mwili inageuka. Sasa mwili inakuwa mzuri. Sasa naona ni mzuri. Hata watu wanastuka. Huyu mtoto aliponaje na ile tumbo yake ilikuwa inafura. Mpaka wengine walikuja wananiuliza, dawa gani uliponesa naye huyu mtoto kwa ile tumbo? Nawaambia tu ni Mungu alimponesa.
Saa zingine nakuwa na stress, nafikiria hadi nasema sasa babangu alikufa kwa nini? Aliniacha hapa kwa nini? Nyanyangu ananiambia, wacha stress, utakuwa tu vizuri.
Sasa mimi ndio mama yake, ana mama mwingine. Sasa lazima umuongeleze vile mama anaweza kuongeleza mtoto wake. Asome, aishi vizuri, akae vizuri. Hata yeye saa ingine anasema, "Madhe, nitakuletea box." Namwombea Mungu akikubali aniletee. Box ya nini? Si ya chakula. Ataniletea box ya chakula.
She likes me. She takes care of me. Anything I want, she just gives me. She's my only hope.
13-year-old Brian, also not his real name, is determined to be an engineer when he grows up. He knows he's talented and isn't shy to talk about it. For years, Brian didn't know he was HIV positive, only that he and his mother took medicine from some unspoken ailment.
Nilipokuwa na mimba niliambiwa kwenda kupimwa, nilikataa. Sikuenda sababu nilikuwa na uoga. Sasa nikamzaa tu hivyo. Nikamnyonyesha kama sijafundishwa ukinyonyesha mtoto kama uko positive unakaa hivi, sikujua. Alikuwa na ugonjwa ikimkujia hata kama ni malaria, mtoto analala kwa nyumba hata mwezi moja kama hajaenda shule. Nilipoenda kupimwa akajulikana. Nilikaa karibu miaka 3 kama sijamwambia status yake. Ikafika wakati akakataa kumeza dawa, niambia mbona nampatiaga yeye peke yake dawa na wengine wamezi. Nikamwambia uko positive hepatitis. Akaniambia hepatitis ni nini? Nikamwambia daktari alisema hiyo ugonjwa inakulaga roho ya mtu. Sasa meza dawa, usipomeza dawa itakuua. Akaendelea na dawa, sasa anameza.
Brian's resistance to taking medication became more deep-rooted as he grew up.
Hiyo ugonjwa ilikujaje kwa damu yake na hao watoto wengine hawana. Sasa ndio ilinibidi niende niambie daktari ndiye amwambie.
Even after his status was revealed, Brian still had scanty information about HIV.
Sikuona kama ilimuaffect. Nikamuuliza, ulisikia ile kitu daktari alikuambia? Akaniambia, alikuambiaje? Ati niko positive HIV. Kamwambia hii ugonjwa haikukupata kwa kupenda kwangu. Ilikupata kwa sababu mimi pia sikujua na nilikunyonyesha na mimi niko positive. Sasa nataka ukubali umeze dawa.
Niliona kama yeye pia anameza hizo dawa. Sasa aliniambia nimeze tu hizo dawa. Nitazidi kuishi duniani.
Disclosure is always a delicate thing. Parents are often afraid to tell their children because they fear the consequences of stigma. Adolescents living with HIV face stigma from their peers and a society that constantly discriminates against them.
My mother told me that I should disclose to my friends that I am HIV positive, and even my teachers. The first time I told them, they didn't like it. Then they didn't even like to work with me, that I will transmit the virus to them. Came back here and told my mom that now I don't have friends since I disclosed to them about my status.
I feel very bad. I decided I could even die with her, so that our chapter will be closed like that. One day I came here, I prayed, God give me something which I can tell this child. And then I just took her, we sat down, I talked to her, she understood me.
Then I told my class teacher about that. Then my class teacher warned them and told them that HIV cannot be transmitted through walking or shaking hands. That HIV is transmitted through sexual intercourse. They changed, and even now they love me in that class.
At school, Kate experienced the full extent of people's fear and ignorance about HIV.
Nikiwa shule, watoto hawakuwa wanapenda mimi, lakini wengine walikuwa wananipenda. Wanakuambia toka hapa mwe mtu mgonjwa, enda kaa pale. Alia, kwa naendelea tu na kusoma. Kwa watu wenye nikubali nikaa na hao.
Being in school made it difficult for Brian to keep his status to himself as teachers and pupils became increasingly curious.
Nikiomba ruhusa ati naenda kuchukua dawa Homa Bay. Walimu walikuwa wanakataa ati siendi, siwezi wacha shuleni, tunaenda kuleta dawa. Niambie tu mama wangu ndiye aende anilete.
Nikiomba ruhusa naomba kama leo, naambia kesho hatakuja. Tutaenda clinic. Mwalimu anigombanishi, nikishaenda akiona mtoto anamwambia unaenda clinic kila siku kwani wewe uko na mimba. Si useme tu mama yako nataka umsindikishe kwa clinic sababu wakati huo nilikuwa na mtoto. Unajua lazima niende na mtoto mdogo na yeye pia. Nikajaribu kumwambia, hawakusikia. Mpaka ikafika wakati class teacher anamchapa. Akikosa kuenda, tukienda clinic kama leo, akienda shule kama kesha anamchapa. Sasa ilifika wakati anaogopa aingie kwa shule. Anatoka tu hapa anaenda shule haendi. Anaenda shule haendi, haingii kwa darasa, ako tu huku kwa kichaka. Ikifika lunch time yeye anakuja tu. Na nilipogundua nikasema hapana, siwezi lazimisha mtoto na pali hawezi soma. Acha nimpeleke kwa hii shule nyingine nione kama huko pia watanisikia. Sasa nilipoenda hapo nikaongea na head teacher, akakubali nimpatie dawa mpatiage na anaendelea vizuri sahi.
In school nobody knows my status, it's only teachers. The teachers treat me well and they love me.
However, this is a resilient lot. They've refused to let the disease define them. they take their medication and forge ahead, living confident and strong lives.
Stress sina. Na kunyonga madawa naishi. Naendelea na maisha yangu vile watu wanaendelea.
Nakula vizuri, hata simisi kuchukua dawa. Hata kama nimesahau, nyanyangu ataniambia ati enda uchukue dawa, saa imefika.
Kitu kinanisumbua, sijui hii dawa itafika nayo wapi. Hiyo ndio inanisumbua. Kama na sasa amekuwa kama mtoto yangu.
Siendangi na dawa shuleni kwa sababu wanafunzi watanichekelea. Wataniuliza ati kwa nini unakunywa dawa?
Ninameza dawa saa 2 na nikimeza nameza tu kwa ofisini. Hao wanafunzi hawajui kwa sababu ni uoga wangu. Siwezi kumwambia. Wengine wanaweza kama marafiki zangu, wanaweza hata kuniacha.
Kenya has the 4th largest HIV epidemic in the world. The national HIV prevalence rate stands at 6%. According to the National AIDS Control Council, Homa Bay County has the highest number of people living with HIV in the country. The HIV prevalence stands at 25.7%. There are 19,370 children living with HIV in the region. Majority of these children contracted HIV as infants through mother-to-child transmission, growing into adolescents. Some have persevered despite losing a parent, even two. Some are incredibly healthy, while others struggle to stay well. And many survivors are now teenagers, only beginning to understand, let alone share, the secret that they and their families had guarded so carefully for so long.
If you take medicine at the right time, you will not be sick, and you might even live for a long time than those who are living HIV negative. And even HIV is not a death sentence.
With this at heart, Rachel decided to join a support group at Magina Health Facility, Ndiwa Sub-County, and learn more about HIV and AIDS. She wanted to empower herself and help others also dealing with their diagnoses. The group, which is supported by Elizabeth Glazer Pediatric AIDS Foundation, has become like a safe haven for children and adolescents like Rachel living with HIV.
Si kila mtu anajua saa zile anameza dawa.
This is where they're all treated equally, where they can play, sing, dance, and just be themselves without fear of stigma. Kate and Rhoda too joined the group. The two come at the health facility once every month for regular checkup, to refill their antiretroviral prescriptions and to receive psychosocial support.
Kuanza kutengeneza hii kikundi cha adolescents ilikuwa ngumu. Kwa maana walikuwa wakikuja wanakaa chini ya mti, wanangojea mpaka wakubwa watoke. Halafu wakishatoka ndio wanakuja baadaye ati sister nilikujia dawa. Sasa they were shy. Haya. Ndio wakaanza kukuja kuchukua dawa sasa on weekends. Sasa ndio wakaanza kujijua vizuri, wakaanza kujielezea vizuri, wakapata ile strength. Kwa maana wanaona kumbe sio sisi peke yetu. Kikutana kwa kikundi, mmoja anauliza mwenzake, we unakunywa zako saa ngapi? Mimi nakunywanga saa kama hii. Usikunywe saa kama hiyo, kunywa saa kama hii. Na umewaambia rafiki zako? Mimi nimewaambia, hata wananisaidianga. Sasa hiyo imewasaidia sana kudisclose. Kitambo walikuwa wanaona kama watakufa. Na kitambo wazazi wao walikuwa watu wanawaambia ati hii dawa mnameza sababu mko na TB. Hawakuambiwa ati wanameza dawa sababu ya nini. Na tangu tuanze this group, nianze kuwafundisha what HIV ni nini na inaendelea nini, naona wameendelea vizuri.
Support group has given me a strength, and nowadays I'm not afraid about my status, and even I can just disclose to my friends and even talk about HIV. Even in science lesson I used to participate in the health education.
Support group has helped her a lot. She's active in class, participating in athletics, everything, drama. She's strong. She's the director of the Pathfinder in our church here. In school, she's a class monitor. I'm very much proud of her. She's a role model to everybody.
Nilienda kwa support group, alafu nikapata watu wengi. Hadi nikasema kumbe si mimi peke yangu. Kumbe ni watu wengi pia wanaishi na hiyo HIV. Nilikuwa na furaha na wao. Tulikuwa tunacheza, tunafundishwa, hata nisiishi na stress.
Intensified focus on outreach to adolescents started in 2014. The Pamoja Egg Puff project is working to address the unique needs of adolescents living with HIV in Homa Bay. Magina Health Facility introduced a comprehensive adolescent health package last year in recognition of the specific need for care, support, and treatment of younger children transitioning to adolescence.
We partnered with the ministry to try and offer youth-friendly services in most of our supported facilities. One, by identifying the suitable days and the time to see them, and that is the weekends. They needed a special place for them because they have unique needs, and you have to handle those unique needs in a unique way from the other population. Keeping the appointment improved greatly to almost 90%. They could attend the support groups over the weekend, and all the services were being offered at that time.
43,438 adolescents were tested for HIV in 2015 in 4 of the 8 sub-counties of Homa Bay. Out of these, 1,158 adolescents are on treatment in the 4 sub-counties.
We are reaching quite a big number of adolescents. And we are able now to follow them, unlike before. There's a change of behavior because, one, they have now accepted that they're actually living with the HIV. And in this same group, we have even those who are not HIV positive attending the sessions, which is a good show because they are able to interact, they are able to share what the other group is experiencing, and actually they can learn a lot from those who are infected, and they use that to enable them remain HIV negative.
Stigma is no longer there, or even if it's there, at least it's minimized. Planning to roll this out to all the other facilities so that we move together as a sub-county and even as a county so that some people are not left behind. The healthcare workers have already been sensitized on the adolescent care of package, and they need to have the adolescent-friendly services, and this is just one of them.
The high infection rate among infants is blamed on home deliveries. 36% of HIV-positive pregnant women in Homa Bay do not deliver in a health facility.
That is also a great concern to the community around here. The midwife at home ruptures membrane, and this person lives with what? With HIV. So we get that infections. And in the process of cutting the cord, the child gets infected. You see. So when the child comes already positive, it is painful. But since we are creating the awareness, I think the prevalence rate will reduce.
Globally, new HIV infections are increasing among young people. There are 1.6 million people living with HIV in Kenya. 16% of these are adolescents and the youth. According to the National AIDS Control Council, 29% of all new HIV infections are among adolescents and youth, especially in young women. This translates to 3 in 10 new infections are among youth aged between 15 and 24 years. The survey indicates that 8,816 adolescents between the age of 15 and 19 years were infected with HIV in 2014, while 20,536 youth between the age of 20 and 24 years contracted the virus. The new infections were attributed to early sexual encounters, where 20% of youth between 15 and 24 had their first sexual experience before their 15th birthday.
They are taking drugs, they are drinking alcohol. They may not even remember to use a condom. So they have sex and they don't even know the status of the person they are having sex with, so that increases new HIV infections among adolescents.
We have left, I think, in many ways, the education on issues such as sex, on issues such as sexuality, on issues such as HIV and pregnancy, mainly to peer relationships and to the internet.
Kenya is among 6 countries in the world with the highest number of adolescents infected with HIV and AIDS. In a recent survey which was released by UNICEF in November 27, 2015, almost half of HIV-positive adolescents worldwide are in 6 countries: South Africa, Kenya, Nigeria, Mozambique, Tanzania and India.
The increasing proportion of adolescents who are living with HIV, this transmission among the adolescents themselves, from those who are already infected from mother-to-child transmission, transmitting the virus to other HIV-negative adolescents. And this can be explained by the fact that most of our adolescents, they fear stigma. So they'll have a sexual relationship with another adolescent, but will not tell them that I'm HIV infected. Young adolescents having sex with older men. These older men are likely to be more sexually experienced, maybe higher chances of having HIV, and so they're acquiring HIV. And then at the end of it, again, they have sex among themselves.
More than 400,000 adolescents are living with HIV in Kenya, while another 119,000 have the virus but are not yet identified. A report by National AIDS Control Council indicates that Nairobi County is leading with 49,904 adolescents living with HIV. Homa Bay comes second with 46,530, followed by Kisumu at 37,110 and Siaya at 33,810, while Marsabit has 450, Tana River 360, and the list is 150 in Wajir County. 17% of all AIDS-related deaths are among adolescents and youth. According to a survey carried out by Plan International Kenya, most HIV-positive adolescents are or intend to be involved in sexual relationships.
Huwa namshauri usikuwa rafiki ya msichana yoyote, sababu ukishikana msichana rika yako utamwambukiza virusi.
Namwambia ukienda na mabwana, hii ugonjwa utazidi. Nasikia? Ananiambia hivyo. Namwambia unajua wewe ni mgonjwa. Mtu hata akikutaka unaniambia niende nimwambie huyu mtoto, usimwambie maneno kama hiyo.
I've discussed in her. She knew everything. Aliniambia nikimit na boy without CD nitapata mimba, nitapata STIs, nitapata pregnancy. Right now I'm sick. Nikipata mtoto pia. When will I go to? Without education, no everything.
Next year I'm going to boarding school and I'm worried how I will take this medicine because there at boarding school pupils are made so they can see me when I'm taking medicine.
Now with the ongoing campaign, the OIN campaign and the other initiatives that are going on around HIV, these things are going to die off.
Comprehensive sexual education that is specifically catered to the unique needs of adolescents living with HIV is wanting. Many adolescents living with HIV are therefore left to deal with sexuality and relationships entirely on their own.
Every time there is a need or a requirement or a request to put it into perhaps even, education systems, or it becomes a challenge. And religious communities are doing a lot to provide information and education, but that in and of itself is not sufficient. I hope that then brings to context the different reasons why we see a lot of what you would call unprotected sex.
The Ministry of Health together with the Ministry of Education developed the comprehensive sexuality education guidelines, which are soon going to be adopted into the school curriculum, which are looking at what age-appropriate information can you give to a child as they grow, so that we are moving from telling them about a virus or a germs which gets into the body and causes this harm, to telling them the reality of HIV as they grow, so that they understand the disease, so that they understand how they can protect themselves from HIV, and so that they also understand other security matters.
I think I will tackle the question of the treatment.
In February 2015, the government launched an initiative. The All In campaign is a global initiative to fast-track reductions in AIDS-related deaths and new infections among adolescents towards ending the AIDS epidemic by 2030.
There is a group of people that have been left behind, and that's young people. And as we realize that they have been left behind, not only in terms of AIDS, that is their death rates, but also in terms of new infections, that has made us to stop, take a step back, and, you know, they always say, take stock of where we were. And so the current engagement in young people is recognizing that there was a gap in the response that needed to be addressed and needed to be filled up immediately. The plan is there, it's got very clear targets, and we've already started to work on it as far as the education sector and the responsibilities of the education sector.
But there are other issues to be confronted. Adolescence is traditionally a time when teenagers engage in risky behavior and look to experiment and gain more independence. In 2013, the World Health Organization warned that the failure to put in place effective HIV services for youth has resulted in a 50% increase in AIDS-related deaths among adolescents globally. WHO requested governments to review their laws to make it easier for adolescents to obtain HIV testing without parental consent. In Kenya, 75% of adolescents don't know their status. And for a teen, finding and getting to a testing facility can be a challenge. Parental consent is needed. But according to experts, parental consent has become a barrier to testing and treatment.
We really do run into challenges, and that's one of the things that we've been asking the legal system to help us address, particularly from the public health point of view. So it is not just testing services, but it is the range of services that are required for young people. The truth is, even if a 13 or a 14-year-old is sexually active, it is highly unlikely they'll go and tell their parents. But they need a counselor to be able to talk to them, and therefore they need to be able to access that service.
Our HIV counseling and testing guidelines recommend that if an adolescent is pregnant, if they are sexually active, if they have got signs and symptoms of HIV infection, or if they are already engaging in a protected sex, then they should have a HIV test done on them. And so if an adolescent goes to a health facility and requests to have a HIV test done, then the healthcare provider should look at those factors and see, do they qualify to be tested without their parent?
The continuing fear and ignorance about HIV in society, however, continues to make it necessary for young people to lead double lives.
Young people simply do not like to go for services, and especially healthcare services. So it's really about being innovative to bring the services as close as possible. As long as we still have stigma in our communities, young people will not get tested, and when they get tested, they will not disclose their status. When they disclose their status, they will not take medication because they're afraid of being stigmatized and discriminated against.
Experts say sex education is inadequate in schools and at the family level.
We also empower parents to be able to have sexuality discussions with their adolescents, especially for parents who probably their children are living with HIV. They need to have a discussion with them. How can you protect another child from acquiring HIV? Even for negative parents and their negative children, how can you prevent yourself from getting HIV? I think that has been a gap for a long time. Many parents assume that their children will be told this by the teachers, and sometimes the teachers also have their own children and they need to tell them about these things. For instance, don't tell a child that we bought you in a supermarket, because a baby will never be bought in a supermarket. How will you then tell them that if you play with a boy, you'll get pregnant? It is good to just let them know that the baby grew in my womb. Then at another age, you can explain how did the baby grow in your womb. So it goes step by step.
But there's still a great deal of work to be done.
It is your responsibility to stop new infections. It is your responsibility to stop stigma. Abstinence is the best way. Do not engage in sexual activity until you are an adult.
Our young people in campuses and colleges and universities, they need to know their status. And I think it's the responsibility of each one of the people in the relationship. It's the girl's responsibility to know the boy's sexual HIV status, and it is the responsibility of the boy to know the girl's HIV status.
Nikimaliza shuleni, goal yangu ni engineering.
Kila siku naombanga Mungu, hata nikiamuka, hata usiku, anipe nguvu ndio niweze kumaliza shule na nifanye kazi yenye Mungu atanipea.
I want to go in high school. Then after that, to go in university. Then I want to be a nurse.
When I finish my primary education, I want to go to a better high school. Then I want to be a doctor so that I can help those whose status are like mine.
And it is the unbowed spirit, positive attitude that will enable them pursue their dreams.